Yeah, it's fine.
Thank you.
So Roy gonna join us on Zoom because his car's gone.
Did you leave?
Well, he was upstairs. He didn't.
He was upstairs.
His car's gone now.
Oh.
Oh,
No, exactly. Yeah, hopefully he doesn't walk in. Oh.
What you doing?
So how are we doing there timing wise, Mr. Board Clerk?
we are ready to go.
Okay, well, welcome back everyone to the afternoon session of the September 20th, 2022 Washington County Board of Commissioners. We have 4 of the 5 commissioners. Commissioners Vi, Willie, and Treese are here with me. Chair Harrington. Not sure where Commissioner Rogers is, but we'll be on the lookout to see if he joins us by Zoom. So we have a couple of topics this afternoon before we close with an executive session. So the first topic is Washington County and its participation in the Reimagine Oregon project, the work plan update for health and well-being. So I'd like to turn the floor over to Ms. Latricia Tillman, our Chief Equity and Inclusion Officer. There's Commissioner Rogers. Now we have a full complement. Here you go.
Oh, thank you. I'll give it back, I promise.
You do not need that much.
Okay. Okay, good afternoon, Chair Harrington and Board. For the record, my name is Latricia Tillman. I'm the Chief Equity and Inclusion Officer for Washington County, and I am joined today by Marcus Ford, Ty Schwefferman, Janine Smith, and Jamie Lou Johnson.
In person.
I know our office was very lively today because we're all here. We're all coming back. We're here today to present recommendations from our Washington County team focused on developing recommendations for the board's response to Reimagine Oregon project demands. For the past 6 months, we've been focused on health and well-being demands per the work plan that the board approved earlier this year. And before we get into the recommendations, we want to provide a little reorientation to your board of the Reimagine Oregon project and an overview of how we organized ourselves as a team to take on this effort. Back to clicker life. The role of the staff team, just as a reminder, was to begin working on informing your board's response to Reimagine Oregon project. And so we will be presenting 10 recommendations across 3 subject areas. And our desired outcome for our presentation today is direction from you on how you would like to move forward with any or all of the recommendations our team provides. A brief refresher on the Reimagine Oregon project is important. It's been a minute. Originally, an overview was provided in more depth in July 2021 by Marcus Mundy of the Reimagine Oregon Project Steering Committee. Reimagine Oregon project was born out of the murder of George Floyd and the resulting protests, and the steering committee, which is comprised of highly regarded, accomplished, brilliant, and educated Black professionals, and 1 former elected official. They all run organizations focused on the well-being of vulnerable communities, including a specific focus on the Black community. So based on their lived and professional expertise, they and many other Black leaders, thinkers, academics, and along with many others working in a range of disciplines, identified that in every single aspect of American society, Black lives are shown that they don't matter. In healthcare, quality of life and lifespan, in socioeconomic status and wealth, in the workforce, in housing, whether rental or owned by homeowners, in policing and carceral systems. The Black community still experiences higher burdens and fewer benefits due to historic and present institutional racism. So Reimagine Oregon project is calling on leaders to continue to commit to dismantling systemic anti-Black racism in our lifetimes. Policy demands from Reimagine Oregon project fall into these 8 categories. And the policy demands came from a compilation of proposals generated out of reports published by organizations like the Urban League, the Coalition of Communities of Color, including their Leading with Race, Research, Justice in Washington County report, as well as newer policy demands from Unite Oregon, the Portland African American Leadership Forum Action Fund, and Washington County Ignite. So these were recommendations that have been generated through community process over a number of years, and Reimagine Oregon project noted not enough implementation of those proposals. And so in 2020, they asked elected leaders from federal, state, regional, county, and city governments the question, what timeline do you get to get this done, and who in your jurisdiction will lead it to the finish line? All right. So this timeline highlights the impetus behind the Reimagine Oregon project and related Washington County Board commitments and actions, including the adoption of the Strategic Equity Action Plan, which specifically calls out our work with Reimagine Oregon project, and board participation in the Reimagine Oregon project elected officials gatherings. And a much more comprehensive timeline was attached to your board packet. As part of their presentation to the board in 2021, Reimagine Oregon highlighted the ways that Washington County has already made and kept important commitments to Reimagine Oregon project. So your work, as informed by the internal team here today, is building on your active responsiveness to Reimagine Oregon project and to the needs of the Black, African, and African American community in Washington County. And at this point, I'll turn it over to Marcus Ford to provide an overview of how we have advanced the work this year.
All right, thank you. As Latricia said, my name is Marcus Ford. I'm with the Office of Equity, Inclusion, and Community Engagement as a program coordinator. Next slide. All right, I got it. So this is just a brief snapshot of the work plan which your board approved early in 2022 that has guided the work of the Washington County Reimagines team, which will be the focus of our presentation today. We're on the health and well-being demands, and so that's what we're going to focus on. I will be brief in my piece so we can get to our actual recommendations quicker. So for context, this is a very unique process for government to be doing. And so I wanted to refresh your board on the advisory committee goals, your role, and introduce the members of our team. We are currently focused on the initial goal of providing staff recommendations to your board for approaches to address the inequities in the Black, African American, and African communities in Washington County. So the 3 goals that were agreed upon for the charter are to develop and share staff recommendations for consideration by the board for approaches to reduce and eliminate inequities borne by Black, African American, and African communities in Washington County, provide an annual update to the board on progress towards Washington County's commitments to Reimagine Oregon project, and lastly, compile data demonstrating racial inequities borne by Black, African American, and African communities in Washington County to inform policy relative to Reimagine Oregon project demands. We will return to the board at a later time to provide those recommendations on the additional Reimagine Oregon project demands, as well as an annual report that includes the data we are compiling. The Reimagine Oregon project has asked elected officials to determine policy and programmatic efforts to address inequities facing the Black, African American, and African communities. They asked elected officials to direct and champion this work. As staff, we are informing your perspectives and providing policy and program options. Moving forward, Reimagine Oregon project looks to you to determine and advance the recommendations you feel should be further developed and implemented by the relevant departments and programs. Okay, and then briefly, I wanted to provide a little bit of context regarding why this is important. So I'm going to read this quote by Ijeoma Oluo. The beauty of anti-racism is that you don't have to pretend to be free of racism to be an anti-racist. Anti-racism is the commitment to fight racism wherever you find it, including in yourself, and it's the only way forward. And they're a writer. And then this scene here, the little graph there, you've seen before. It is just a representation, a visual representation of some of the Black experience in this country. For about 400 years, Black folks have been in this country, and about 85% of the time, we have not had citizenship rights. We were treated as second-class citizens as best, with slavery at worst. And so just kind of a visual representation and a reminder of that. And as for our team, we have a total of about 19 people working on our team for the Washington County Reimagine's Advisory Council. And we have tenure ranging from less than a year at the county to over 20 years at the county. So a wide berth of that. We have participation through our virtual meetings, surveys that we do. We have a lot of shared docs that work on. We record a lot of our meetings when there's a presenter that Ty will talk about in a little bit, and then through email as well. And so we have representation from Black staff in Washington County and from numerous departments, including the CAO, the Department of Housing Services, Sheriff's Office, Land Use and Transportation, County Council, Human Resources, Facilities, Health and Human Services, and Community Corrections. And then I will turn it over to Jamie.
Now that Marcus and Latricia have clarified what our goals are as an advisory committee to Oregon Reimagine, I would like to help the board understand the steps that we took to ensure that the recommendations that we're providing to you today were thought after much consideration. My name is Jamie Wu Johnson. I am an administrative specialist at the Community Corrections, under the Community Corrections Department, specifically the Community Corrections Center. As Marcus mentioned earlier, there are 8 other departments that are represented within our advisory committee. This means we are all coming together with different perspectives and background knowledge bases about how we think the Oregon Reimagine demands should look like due to the variances in perspectives. And we had to devise a set of basic norm / group rules and such. We start off with some very common ground rules when forming any sort of group: speaking your truth responsibly, listening with understanding, and accepting a person as they are when they enter a space, and understanding how much they're willing to participate in this space. We also have the ground rule that took in consideration when there was differing of opinions among group members. If you look specifically at section 4, it's accepting non-closure, and that it's okay to accept that non-closure. This has happened when not all of our members 100% agreed on which recommendations should be presented to the board. But because the expectations of us supporting people to speak their truth responsibly, listening with understanding, voices who did not agree were allowed to voice their differing opinion, and it was received well by the whole group. one of the group norms that that was actually beneficial to the process was the honoring the differences and diversity in our Black experiences. As you can see, we're coming from different, like I said, we're coming from different background and knowledge base. This allowed us to build relationships with one another, and as well as building relationships with the community guest members. By having these expectations and norms in our group, it provides the framework to give the board our best work. Ty can expand a little more about how this relationship expanded to the community engagement.
Great. Thank you so much, Jamie. So I'll have a couple slides just about our methodology. So my name is Ty Schwafferman. I work in the Supportive Housing Services and also the Office of Equity, Inclusion, and Community Engagement. I'm a Community Engagement Program Coordinator. So our steps for each recommendation were as follows. So first we started with data analysis. We reviewed available data and put them public documents that were available. And we put them in a location on our shared drive so that all of our members of our advisory committee could review. We then reached out to an existing network of providers that serve Black and African Americans and Africans in the Washington County area, or are expanding their work in Washington County and want to expand their work in their area. So we invited these as guest community panelists to present to our advisory committee. And then following that, we did some more community connecting. This is about developing the internal relationships amongst each other to get to know each other's different cultural backgrounds, and also develop understanding of what brought us to the field of work that we are in. And then we followed that with the survey, as Marcus had mentioned earlier. We surveyed all of our members of the advisory committee and asked them what recommendations you had. So we considered things like, budgets and available resources or existing programs within the county, and use our expertise as Washington County employees to respond to the survey. And then finally, we did a consensus building process in which all the members had a voting authority, and members used 3 tiers. One was the green, which was supporting of the recommendation. Second was to yellow, which was live with, and kind of live with that recommendation. And then finally red, which was we're not supporting. And then if we had a threshold of more than 3 with red dots on that recommendation, then we would not move that recommendation forward. All right. And so I just wanted to share with you some of our guest panelists that came. So we had Zadora Williams and Cherise Burnett for behavioral health, both practice in Washington County and serve members in Washington County. They gave a presentation on our guest panel, and we recorded that panel, and that was available to all of our members of our advisory committee. Then we had Dr. Roberta Hunt, Keena Harris, and Carol Numsey, and then Dr. Nadia English Williams, all of which serve in some capacity in either public health or maternal and child health direct service or research. So we levered these existing networks and professional networks and invited these experts who have a unique perspective in that they work in the county. And then we also noticed, and most of them responded that they were not familiar with the Reimagine Oregon project prior to our outreach. And then secondly, they did not have that many connections with Washington County staff, and that many of them for the first time were being engaged by Washington County staff. So we wanted to share that with you, that many of them expressed gratitude for the outreach and engagement to provide their professional expertise. I'll turn it back over to Jamie.
As a reminder, these are the policy demands from Reimagine Oregon project, the COVID-19 Black Recovery Relief Fund, investing in mental health, and funding maternal and child health programs. We worked on these from August to March of this year, using the process Ty outlined earlier. And the following slides reflect the recommendations we developed as a result of our look at the data, research, and staff and community input. For the COVID-19 recommendations, after reviewing the allocations of COVID-19 funds for the Black, African American, and African community, the Washington County Reimagine team appreciated the levels of investment intended to address the inequitable burden of the COVID-19 borne by our community. COVID-19 recommendations were focused on long-term quality improvement and quality assurance. The priority recommendations were for long-term resource allocations like ARPA funds, should be used to incorporate process improvements to ensure equity in procurements. These process improvements included things such as funding announcements, informational sessions, and procurement application being accessible to in multiple languages through multiple channels, assuring that all procurements process have a diverse panel of community reviewers that score said applications. Diversity in procurement reviews is an essential element, and it should include stipends to ensure equitable participation. Allocation should include improvement process that engage focused communities that we intend to recruit as proposers, but maybe for one reason or another, they did not apply. So we can gather feedback on our processes. The other COVID-19 recommendation is from the evaluation standpoint. So we encourage the board to assure how well funds were accessed and used by the focused population through culturally specific programs. A concern does exist that when Black clients applied, they were denied because funds had been depleted by non-Black community members. And to reassure funds were accessed equitably, the board can reassure this by reporting the utilization by race, tranche 1 utilization by race, publish synthesized reports from funded organizations to demonstrate how COVID-19 response and recovery funds support healing and resilience in the Black, African American, and African communities. If underutilization is shown to exist within these communities in tranche 1 funding, funds should be reallocated in contingency to tranche 2 funds to increase access to culturally specific approaches. Now, Janine will expand on our recommendations for the other two policies that we focused on.
Good afternoon. I am Janine Smith, Housing Justice Coordinator with Supportive Housing Services and the Office of Equity, Inclusion, and Community Engagement. I will be giving the behavioral health recommendations, as Jamie said. Within a behavioral health area, thank you. Within the behavioral health area, we have 4 recommendations. Expanding models of behavioral health care for Black culturally specific providers to include more than just talk therapy, to include but not limited to ceremonial healing circles, sound healing, sound baths, and sound therapy, drumming circles, and art, for example. Current examples that have received government funding include culturally specific healing for addictions, Native American Rehabilitation Association Northwest, also known as NARA, and holistic funded contracts such as Providence New Beginnings. Since Washington County has a seat on the Health Share Board, we recommend advocacy that Medicaid offer reimbursement for these services, create a county program division team within HHS that is specific to supporting Black and Brown health and mental health to ensure strategies are culturally relevant, and that a consistent commitment supported as an integral part of the county system. We also want to assure through our county benefits package that county staff have access to culturally specific mental health care. We experience the daily trauma of institutional racism, not only in our personal lives, but also as staff engaged in supporting clients through traumatic situations. We experience the secondary trauma. Culturally specific mental health is important to us, and many have noted how difficult it is to access through our current benefits package. We also had a robust discussion about increasing funding for mental health crisis response teams in the sheriff's office. However, we did not elevate this as a priority recommendation as we're unable to determine how much that would actually benefit the Black community, in particular as demographic data is not captured in every crisis response. the maternal and child health recommendations. So Black mothers experience higher rates of maternal mortality, and our babies experience higher risk at birth that impact higher rates of infant mortality compared to all other communities. Given this fact, we wanted to elevate 4 recommendations in support of better outcomes for African American, African, and Black mothers and babies. The first, we recommend the county provide financial support for Black mothers seeking doula care when it is not covered by insurance. The Oregon Health Plan, Medicaid is now reimbursing for doula care, but even though it is a well-documented best practice for improving birth outcomes for all mothers, not all insurances reimburse for doula care or help facilitate access to doula care. Second, we recommend the county help remove financial barriers via scholarships or grants for doula and midwife training for African American, Black, and African women as part of Washington County's workforce development strategy. This should include partnerships with Black-owned or focused schools like Full Circle Doula in Portland and supporting existing local BIPOC scholarships like the Oregon American College of Nurse Midwives Foundations, Lifting Education for Equity Fund. Third, we recommend county-funded pre- and postnatal support groups led by healthcare professionals, including midwives and doulas. The group experience supports community for Black, African, and African American mothers, which can help mitigate risk related to maternal and infant mortality and connect mothers to culturally specific professional health advice at no cost. And fourth, we recommend cultural competency training for county staff developing programs that provide maternal and child services. The norms and traditions associated with giving birth and the experience of motherhood are rich and are determined by culture and community histories and values. The diversity of cultural norms and values related to childbirth should impact the way maternal and child health programs are designed. This concludes the presentation of recommendations across the 3 Reimagine Oregon project policy demands. With that, I will turn it over to Latricia to close out our presentation.
Can I ask a quick question?
Sure.
This is going to be probably embarrassing to me because I'm gonna ask this question because I should know this, I guess. I do not know what doula care is.
Okay.
Asked the same question and she looked it up for me.
Thank you for that question, Commissioner Willie. Doula is basically community health worker, traditional health worker, so not trained through like formal medical channels, but they are intended to provide childbirth support, both prenatal, during pregnancy, at the time of labor, and then postpartum support to the mother.
There are also end-of-life doulas as well. So it is a field of, from this layman, and I don't intend to be complete. Can I borrow your mic?
Pass these mic.
Okay, this one will work. I don't intend to try and be comprehensive, but rather just in a little bit of experience that I've had as a general community member. It seems to be a field of care that is maturing in our community to ensure that people have more access and comfort to care, whether it's with childbirth, early childhood development, end of life support, and I've even seen evidence of helping us age more gracefully as well. So it seems to me like a somewhat newer field for helping us go through the various aspects of the living process.
And I'll just add that, so my master's in public health was focused on maternal child health, so let me nerd out for a minute. There's a maternal child health organization called the Cochrane Collaborative, and they review the quality of research, kind of these meta-analyses of practices associated with labor and childbirth. And they're like the gold standard of best practice. The Cochrane Collaborative reviewed doula models twice, and both times came back emphatically saying that all women who are pregnant should have access to a doula without reservation, that it improves the experience of birth, it improves birth outcomes, it decreases medical interventions in the labor and delivery process. So they are very clear, like that is a gold standard practice. I would say, even though it's been happening for a long time, it has taken quite some time for medical practitioners to figure out how to incorporate doula care into the labor and delivery process.
So doula care is not just specific to the African-American community, it's generally overall.
Yes.
It's just what you're communicating to me in this is that we need to remove financial barriers for Black mothers seeking doula care. So that means that there has been some sort of discrimination in the medical services that we provide, or
So what I would say is, because the data shows that African-American women are 3 to 4 times more likely than white women to die in childbirth or to experience more maternal mortality, and because Black infants are more likely to be born low birth weight or preterm, and also are more likely to die within their first year of life, that making that investment in doula care, particularly for African-American and Black women, is going to help shrink those health inequities.
I see. Okay.
Are we also saying that we're focusing on the development of that particular workforce to be culturally specific as well?
Yes. So the other, I would say, experience is that white women tend to have an easier time finding a doula who shares their cultural identity, cultural norms and values, because of historic barriers and access to training and even to reimbursement for doula services. There is an underrepresentation of Black African-American and African doulas.
Great. Thank you very much. Appreciate that. You didn't even make me feel embarrassed.
You shouldn't. I appreciate your questions. Okay. Thank you. Back to where we are. So first I want to begin with just a sincere appreciation for our entire Washington County Reimagine's team. As Marcus noted, this is very unique. I don't think that Black staff are usually engaged in talking as a cohort specifically about inequities born within our community. And I want to appreciate especially those presenters, those of you who volunteered to present today. We really appreciate them stepping into this leadership role. As I mentioned before, the Reimagine Oregon project approach operates by clearly focusing on the leadership needed from you as elected officials. In our Washington County approach, you agreed that your work as elected officials should be informed by Black, African-American, and African staff, some of whom are here today. And we are offering high-level recommendations for your consideration with the approach that any further work would be directed by your board to the appropriate departmental or programmatic leadership for further analysis and pending board direction for implementation. So at this point, we're ready to answer any questions and determine with you how we can arrive at the desired outcome of this discussion, which is to determine your direction on how you would like to move forward with any or all of the recommendations we shared today.
Could I start first? Mostly because thank you, Latricia. I've just asked my colleagues if I could start first. Mostly because I feel like I need to play an I don't get it yet card. So I think I'm just really grateful that under your leadership, we've been able to harness the brain trust of Black members of our workforce to help figure out how we might move forward with these demands placed on us in our role as a community service provider, as a county government. I am grateful for your guidance, your assistance, and the time and energy that the whole team has put into these topics. As I was listening to the overview of your analysis and methodology, as well as the various recommendations, I was thinking about how some of the recommendations I can grasp as it applies to our employees and providing benefits for our employees that are culturally relevant and specific. There are also, seems to me like there are also opportunities for providing employee training that is culturally relevant following some of these recommendations, as well as further development of the county workforce. I'm also struggling in all of those possibilities with the fact that Washington County has its specific programs that it owns, advances, and implements, but we also have what has been explained to me in this role as state shared services, where the state says, we expect these services to be provided by all counties. Here is funding to go do some of that. Now go do it as the specific provider. Some of these provisions we contract through community partners. Some we do ourselves directly. And then I got a sense that there are some recommendations that could apply externally. You know, there's that circle of influence. There are things that you control, things that you influence, and things that you're concerned about, but you don't necessarily own or have influence over. And my sense is that there's some of those in the mix as well. So this slide was really additionally meaningful to me in that you've made a range of recommendations that would help inform the full scope of our work. And you're looking for direction from us to empower additional leadership analyses on these different recommendations, so particularly as you've enumerated here, what kind of systems would be involved, what kind of fiscal impact and analysis, as well as outcome impact analysis. Am I getting it?
You've got it. That was a great summary.
I really was not feeling at all sure about this, folks. I really wasn't. So thank you for your patience in this, because the light bulb, I felt like it was rich data, but somehow my light bulb wasn't going off. So I was a little embarrassed.
So let me just address that a little bit, because I think in the uniqueness of this model, it's like we're trying to thread this needle, right? Yeah. The Reimagine Oregon project wants commitments from the board. So they don't want commitments from us, they want commitments from you. We are helping to inform your commitments. But we all have day jobs that may have a different focus. We're not behavioral health professionals. We are not focused on COVID 100% of the time. We're not maternal and child health professionals. So we are providing these higher level recommendations, which then we're asking you, which ones do you want to ask the actual professionals who are doing maternal and child health or behavioral health work or COVID related work all week, all day, every day, to do more analysis to see what's feasible to actually make a commitment on. It could be all 10. it could be a subset of the 10. And after doing the deeper analysis, it may be identified that 2 or 3 are going to have the kind of impact that the board is wanting to see and that the board is willing to commit to. So that's the needle that we're trying to thread.
So it leads me to think that a potential next step would be for us to ask our CAO to take these various recommendations and go to our subject matter experts in the different departments and identify which of these seem to be under our direct control for our employee base, as well as for our programs, and and which ones we have control over for our community, and as well as influence over and concern over. And for each of these recommendations, what we need to understand we're already doing or not doing, what we might consider doing for the short term, midterm, and long term, and what further next steps we may go through to provide feedback back to the Reimagine Oregon project, that we see ourselves able to do something with this, with that, but not with this, but not with that. And part of that feedback will be the nearer term, the middle term, the long term, and some things we may not be able to investigate. Can't report on now, it'll have to wait till the middle term. Because we still have to do everything else we have to do. But if we're going to address the institutional and systemic racism of the past, we need to take some actions to be intentional moving forward. And here's one way we might do that. Am I in the right space?
You are.
Okay. I think I've taken the floor long enough for now. Colleagues, what do you think? And what questions do you have?
I'd like to build just a minute on what the chair was saying. And while I agree that I believe what you were saying is that we need to send this out to those professionals that are in the field to look at this. But I think what's really important is that when we do that, that we say we support this Black lens on these activities first. So then let's talk about what's feasible. But I think that that's an important step. And I'm certainly willing to say that's important to me as we go through this, because that's what this is about. Not the entire population at this point in time, but as we look at our Black community. So I just want to make sure that that's part of it.
Okay.
And Commissioner Treese, you may say that for all 10 of the recommendations, or you could also decide as a board, we want to hone in on some subset, but I don't want to presuppose that you're all in on all 10.
I am, but I just think that reminder to all of us as we go through this process, and it resonates with me after being involved in the Reimagine Oregon meetings and being a part of that I think it's really important that we identify what that is. That doesn't mean that those learnings don't transfer into other situations at the same time, and most likely they will. But I think that this is what the purpose is in terms of asking our professionals.
Other commissioners?
Yeah, I'll jump in, Chair Harrington. Thank you. This was a really great presentation and great to see you all. And I really enjoyed reading the materials and the presentations. And when I was reviewing this material, the COVID recommendation, obviously I was on the boat with you, Commissioner Treese. Let's do all of them. But I think there's a lot of them, and I'm especially interested in the COVID ones. And then I got into the behavioral health, and I saw at least 3 of them seemed appealing to me to say, let's move forward with these, as well as all of them. Then I got to the maternal health piece recommendations, and I sort of had like a question about, wait a minute, do I even actually understand the big umbrella with where Washington County is? Obviously, I'm coming in with a different example from a previous county that I worked for, which had maternal mortality or maternal child health. I think I'm mixing the committee that I sit on, which is the maternal morbidity and review committee, but this is maternal child health. Not to get tongue twist. Going back to my point, that program had a Black specific program that sort of dealt all of the recommendations that you're recommending. So I'm wondering if we can pause for a second and maybe talk about, is there a program specific within Washington County that sort of does like the Healthy Birth Initiative program that I'm comparing to? I think that would, otherwise it seemed, how would we do this, this recommendation sort of? I just, if I paused when I was reviewing the material. And so I don't know if you all have any comments right now and explanations that you could provide to help me understand sort of the big umbrella, the big program that this would sit in. Or how do you see moving forward with this kind of, if we were to say all of them, how do you go about?
So what I would share about the maternal and child health recommendations is that early on, I did have a couple of meetings with the maternal and child health program within Health and Human Services. And they expressed that they are also interested in having a culturally specific maternal and child health program similar to the Healthy Birth Initiative in Multnomah County. But recognizing that that program is very much focused on African-American community members, mothers, fathers, and infants and up to 2 years old. And Washington County has a really different demographic makeup that is more diverse in terms of African-American, and Black mothers, that there would need to be some modifications. And so I think that these, one, I believe that there's already funding that's been allocated through the COVID funding. So I think within ARPA funding, there's already some allocation that's been made. And then I think these recommendations could be incorporated or further analyzed to see how it would fit in with the model that they're already starting to work on.
That's related to the next step of
Yes.
checking in with the subject matter experts to hear their thoughts on the recommendations. Is it work they're already doing? Short-term, midterm, long-term, next steps? Heads are nodding. Okay. Sorry,
And I would just add that, kind of as a reminder that this is one of 8.
yeah.
In terms of the grand scheme of Reimagine Oregon. And, you know, I came in and I didn't know a lot about maternal and child health. I'm a male with no kids, right? And so I learned a lot through this process. And as we move forward through the next step, right, our next focus is going to be housing. All right, we have 2 folks within our housing department here on the panel today. And so we kind of just use our group expertise as we're looking at all of these. But at the end of the day, it does need to go to those actual leaders and subject matter experts within the county to see, like, is this viable? Can we do this? And what's it going to cost, essentially?
Do we have all of these? I know they've made policy demands as a whole, these 8 different areas. Are there demands of Washington County for all 8?
No.
Okay, so for some reason, I thought there were 3 particular areas that we were active in. And I don't know if that's bad memory or just something I totally made up. So health and well-being, housing and homelessness. Was there another one about?
The legislative process, there's one there. We'll get to that after housing and houselessness. And then I'm not sure if it's police and carceral system or community safety that they're working.
Yeah.
So that's a defund the police request? Or am I confusing with something? Or am I?
There were demands that Reimagine Oregon project made. And then there, in the work plan, there were some areas where the board was clear, we're not doing that. And so we were gonna look at what are some other areas that we could look at under that umbrella.
Yeah, I have to say, I should have gone back to look at the February information or the prior information where we had the work plan. So I'm not coming into this with a full deck of information myself. Didn't do that part, so. Well, I don't want to get in the way of other comments. But I am, on one hand, this is fantastic work and I'm grateful for this brain trust. And I want to see better outcomes for our employees, for our community and all community members. So in that way, yes, I do want to commit, but on the other hand, I recognize that implementation needs budget. So I would like to understand what we need to do for follow-up, for example, within the next 4 years on execution in order to deliver on full commitment. So there's still a space, and believe me, sometimes there's an articulation of, well, I need more information before I can commit, is often a delay tactic. And that is not my intention here at all. But rather, I want to make sure that for these areas that we've identified in our work plan, that we will make progress in various categories and not just in one area at the expense of all else. So I'm feeling comfortable that I do want to see these 10 recommendations listed out and engage with our subject matter experts to understand where they think they are already doing some work, where they think it would require or involve either additional direction, additional resources, additional time, so we can start getting our heads around. And others may just be that we have to turn around for our employees and ask for different aspects of the insurance benefit package, right? So, our subject matter experts would be able to inform us about that. So I am in full support of wanting to get better outcomes for our employees and for our community. But it's very clear I need further information in order to better articulate what that means and what it involves. And I don't know if I'm alone in that or not. Commissioner Willie, go ahead.
Well, you covered a lot of turf. So I just want to make sure I understand what it is. I understand what you're asking, and I understand what you've communicated in pieces, but I want to make sure that I get the full picture. So I'm going to go back to your policy demands, that slide. And you said you're going to focus on health and well-being. That's where we are right now. Then it's a housing and homelessness. And then it's community safety.
Legislative process is third.
Okay, is that another one? So legislative process. So we're looking at 4 of them, not all 8. Okay. Just a second. Next steps would be, so we're going to stay on this subject for right now. We give you direction to go forth and go deeper into your evaluation.
We make a friendly amendment to that, back to the chair's comment. You would be directing the CAO to direct appropriate subject matter experts to do that deeper dive.
Right.
Not us.
I didn't mean you, but I mean, you're kind of the front person. Yeah, we can see on you, but yeah, for the work that you've done, you just kind of started the process. Now you're going to bring in the really smart people and the experts on this and go further. So I'm good with that.
Not to say that these are not the really smart people. because they-
Yeah, I knew I said that wrong.
Okay.
But
You notice I.
you got the drift here, okay?
I'm with you.
So then the next thing is you're gonna pick a different demand and kind of do the same general overview review, okay?
Yeah.
I'll come back to that. I'm looking now at the slide that shows on the COVID-19 recommendations, and I kind of got you're wanting us to review what we did with the tranche one money by race. Okay, and then if we find that it was not equitable, not just with African American, but with across the races, I'm assuming we're incorporating all of the races in this. It's not just Black specific. Am I correct in that?
Our focus and our scope was Black, African, and African American.
But we don't want to redo this again for the Hispanic community or the Asian community or.
I think that if the board wanted to move in that direction, that's a positive direction. It's just outside of our scope.
Okay. Well, I'd like to think that if we're going to do this by race, we do it by race. So there's no reason to just go through and filter out everything else but that. So anyway, that's just my thought on that. And then if underutilization exists, funds should be reallocated. I don't know how we would go about doing that if the funds have already been spent, but anyway, we can cross that bridge when we get there. We can just make sure the tranche two doesn't do the same thing. Okay.
There you go.
All right. As far as the other ones, behavioral health recommendations, maternal and child health recommendations, I think we do what you're suggesting we do on that. I like that. I'm intrigued that we would have a health package that would not be across the board and be inclusive of all the needs of the different races of our employees. But I guess that's the reason why we have you, is because we've never looked at it from this filter, this lens. So yeah, I think this is a good process. I don't know how long it took you to get to this point, but you've got 3 other fairly major ones coming at you. So it sounds to me like long-term employment in this environment. And I realize that it's not part of your daily job. So thank you very much for your commitment and certainly investment, personal investment in this process. So I think I'm good with that. And if all of that aligns with what the chair said, good. Okay.
Thank you.
And while you were speaking and I was valiantly listening to you, I pulled out the January. I did a quick agenda packet search and they did sequence these out in the work plan. So for these different topic areas, this is the first one. 6 months to sort out what next, an analysis, and let's figure out next steps. 3 months later, do the next category. 3 months later, the next category. 3 months later, the next category. So it's a process for looking at these different areas, and we're just peeling the onion and learning more and sorting out opportunities.
Okay.
Is what it feels like, versus a sign on the dotted line. Absolutely, this is what you're gonna do, how you're gonna do it, when it's gonna happen, and we're gonna measure it.
Well, I would guess that we're in this process because we have to look at what it costs to do all this study and to hire these experts. That's gonna be a part of the kind of the next phase. Tanya's gonna be the one that's oversees that, I'm guessing, and communicates back to the board what our, not only our financial investment, but what our employee investment is gonna be in this, so.
And we're not recommending any additional hiring of staff, but asking the staff and the leadership who have oversight over these areas to do the analysis of these recommendations for which ones can move forward.
Okay. All right, thank you.
Commissioner Rogers,
I don't think I have a lot to add. Jerry was asking sort of where I was going. I've always believed that things ought to be universal. And so if we're adopting policies, they ought to apply to our Hispanic, our Asian, our Islanders, whatever you want to do. And so I really don't like the narrow focus. That's my belief. There are principles that we haven't talked about today because we're not ripe to talk about them today. I frankly don't like defund the police. I don't like it. And so that's going to be later on. As far as the public health, there wasn't anything in here that to me was not something we ought to be doing. And I too agree that maybe the insurance coverage we have ought to be explored as an option. So there's nothing there. I continue to say, and this is Roy talking, that I don't like the word demands. I don't make them of anybody else in my life or any group. I don't demand anything. And I know we've had that discussion and there's a reason for that nomenclature, but to me it's offensive, but it's what we continue to deal with. But as far as the topic today, and that's the only topic we're dealing with, it's kind of embarrassing that we hadn't done a lot of this before. I mean, there's nothing there that doesn't make sense as far as what you're proposing. I'm only talking to you're not talking to him because he treated me badly in the bathroom. And you know what I'm talking about.
I do. Rightfully so.
Yeah, right.
Did you say in the bathroom?
Yeah, I had a swish shot and you have such cat-like athletic ability, you knocked it down before it even got halfway there.
So we digress.
We digress.
Okay, I don't think we need some bathrooms.
Yeah, no, we're just teasing with each other, but no, there's nothing there that I would add that needs to be changed. Again, I hope at some point in time, we look at the demands, we look at the multi-racial impact. I agree with the point that Jerry is making. We need to look at the cost of all this, obviously. That's not to defer it, it's simply how do we pay for things? But to me, this ought to be a part of our insurance package. I mean, that shouldn't be any big issue. So that's where I'm at on this topic.
I just want to, given that I had the opportunity to look at our work session information from prior in this year, January 4th, as well as March 7th or 8th. For the public safety one, we've already said before, we're not defunding the police, okay? And what the public safety aspects are that will be scoped in 18 months from when we adopted the work plan was to explore within constraints restorative justice practices and trainings for educators and students, and ongoing support for community-led Reimagining Public Safety Project Advisory Council, which is a program that we have put our dollars behind. So I just want to, because it was expressed here, want to remind our community members as well as ourselves that we are in no way defunding our police. In fact, we have done the exact opposite. So.
And I appreciate you making that comment. You've made it before and I agree with it entirely. But I think it needs to be said over and over because that's not a message that I'm hearing outside from some people there. We just got to keep saying these bright things over and over.
So I think in summary, what you're hearing here from the board is direction to have the CAO move forward in engaging with our subject matter experts. Is there anything else you'd like to add to that summary in terms of direction?
Thank you, Chair Harrington and Commissioners. It's been a great discussion. I've taken a lot of notes, and I do think the question really was, just as you've all said, what would it take? The direction from the board to the county administrator to look at the subject matter experts and what would it take? Which ones, what subsets, just as has been summarized today. So I don't think I have anything to add. Thank you.
And out of that 10, I would add, if not moving forward, then why not?
Right.
So that would be great.
I have-
Thank you, Brain Trust.
Chair Harrington, I have a question. In terms of like next step, is that what you were asking? Your question to direct, you got the directions? Okay. Yeah. I think I was hearing Tanya and then points. So I just wanted to, for my own sake, I heard what was being directed. So all 10 of them.
And thank you for your work too. I just want to make sure that's on the table. Appreciate it.
Thank you very much.
And Ms. Tillman, if I could just verify, I'm not sure that I've Reimagine Oregon project here in 2022. Is there something I'm supposed to do between now and the end of the year?
Yeah, there was an elected official meeting
Right.
early 2022. I believe something went out today from
In a meeting.
Reimagine Oregon
Oh, okay.
project. They may have another gathering before the end of the year or early in 2023.
Okay, terrific.
I
Thank
just went to their website and a lot of it has been kind of suspended. So there's information clearly that they're working on right.
Great. Thank you again,
Thank
team.
you.
Really appreciate this work.
Woodwork.
We'll turn it over to an entirely different aspect of our world now and department. Over to our land use and transportation experts, especially our transportation experts, to talk about the Major Street Transportation Improvement Program, MSTIP 23 through 28.
Bad news is Latricia took all your time.
Good news is I talk fast.
It says here you have 40 minutes.
Yep. Okay, we started the prior topic earlier. It took longer, so calendar wise, we are on track.
Excellent. Well, thank you, commissioners. Glad to be back here before you this afternoon. We're here to just give you another update on our Major Streets Transportation Improvement Program funding allocation process for the 2023 to 2028 cycle. And primarily, we'll be talking today about a summary of the community outreach that we engaged in over the summer. And then we also want to share with you updated project cost estimates that we've been receiving from the consultant that's helping us to do that. With me today are Aaron Wardell, our Principal Transportation Planner and Interim Planning and Development Services Manager, and Chris Effenbach, our Senior Policy Analyst, who are really the pros that are doing all the real work here. And I should say, coordinating the real work that we have a whole team of folks. So with that, I'll go ahead and turn it over to Aaron, who's going to walk through the presentation.
Thank you, Stephen. I remembered how to use the clicker. Haven't been here in a while.
Yeah, welcome back.
Oh, we're happy to be here. As Stephen said, I'm Aaron Wardell. I'm the Principal Transportation Planner and the Interim Planning and Development Services Manager. Today's presentation is primarily an update and a review opportunity for all of you. We don't have any action items before you today. We will be coming back later this year or early next year for some more action items. So today we'll be talking about our refined project list, reviewing our community engagement results from our work this summer. We'll be talking about the project information and the updated refined project costs that we've received back from our consulting team, and then reviewing our next steps. So the policy questions we'll be coming back to at the end of the presentation are, does your board have any questions about our community engagement efforts? Does your board have any questions about our refined project cost estimates? And what additional information would be helpful to you as we move forward with project prioritization discussions? So as a review, Washington County and the cities within Washington County submitted 33 projects for consideration of proposed MSTIP funding. We did a technical review of all of those projects, worked with our city partners through the county coordinating committees, Transportation Advisory Committee, which is made up of city staff and some of our agency partners. We also engaged with our community-based organization leadership to do a review of those projects. Based on that review information and your board's input, we cut that list down to 25 projects to take out for community engagement. We then proceeded through the summer of doing a pretty robust community engagement effort around those projects to really get a feel for the community's priorities around that project list. So our community engagement on project priorities took place in the months of July and August. We held an online open house through those weeks of July 8th through August 19th. We also participated in 15 in-person community events. These were community events that were already happening. We did some culturally specific events. We were at the Washington County Fair, a number of farmers markets, Hillsborough's Tuesday night markets, and you can see the stars on the map up there, all of the locations where those events were held. And for those events, we distributed information to people about how to participate in the survey online. We also held paper copies of the surveys if people preferred to complete a paper copy of the survey on site. And through all of these various efforts, we think that we had a pretty successful engagement response. We received 975 total survey responses. 721 of those came in online and 254 were collected at the various in-person events that we did. In the survey tool, we asked respondents to select up to 3 projects per commissioner district. And we shared the project information with the community without project costs because we wanted to get a feel for their real priorities without thinking too much about the dollar amounts. It's also a hard conversation to have when some of the projects have extremely different cost estimates and we weren't complete yet with the consultant refined cost estimates. So we really just asked them, what do you think? What are your top 3 in each commissioner district? So what we heard from the community based on that question, without asking them any trade-offs or asking them dollar amounts, all of these projects had support from the community. Even our lowest number of vote getters still got quite a few votes. People also had the opportunity to give us general feedback about the transportation system. And so we heard that people want sidewalks and bike lanes. We heard that people want less congestion. They want to be able to get to where they need to go, and they want to feel safe in our transportation system. They want there to be lighting and other safety improvements, and people want to be able to access transit. So these messages were all consistent with what we heard in the phase 1 of community engagement that we did through the MSTIP program. People also told us that they have a variety of different opinions about how to fix the problems that they see in our transportation system. A couple of treatment types such as roundabouts have a lot of opinions, both in favor and not so much in favor. And so we heard a lot of feedback about that.
I found roundabouts very confusing.
A lot of community members share that sentiment. Yes, we have heard that from many people. But I think there was general consensus that something should be done at all these locations. So people had a variety of opinions about what the thing should be, but they really like all the projects and they want something done in all of those places. Again, when we ask them that question without project cost associated with it. So this next set of slides you received in your packet, it shares the number of times each project was selected within each commissioner district. I'm not going to talk through all of the votes individually, but I think that the takeaway from this is that even the projects with lowest number of support were picked over 100 times across all districts. And so there really is a lot of support out there for the projects. And that some of the projects we talk about pretty often around here are the projects that rank the highest. So the community is echoing a lot of the same things that we've identified as county and city staff and as elected officials from Washington County. So in District 1, we weren't very surprised to see Farmington Road emerge as the #1 priority. For example, that's a project we've been talking about for many years.
Explain that Farmington Road process that is a partially ODOT arterial, not all of us, or was it just Farmington Road?
We shared the description generally of what the project would be, so the extent of what that segment of Farmington Road is, and then we shared that the project would be a complete streets project where we would add sidewalks and bike lanes and additional vehicular capacity where needed. I'm not sure if our materials stated specifically the jurisdiction of the road or that we're considering it as a jurisdictional transfer, but when we have those individual conversations with people, that is some of the background that we would provide to people.
Pertinent for this conversation.
Yeah.
Okay.
There's a lot of information to share about all the projects for sure. And then for District 2, not really a surprise that Beaverton, Hillsdale, Olson Road received the highest number of votes. I think we could ask this question of the whole Portland metro area, and people may choose that intersection. So I know we've had a lot of conversations about that one over the years. And all of these segments of Walker Road had a lot of support, the TriMet Max overcrossing at 185th and this Ultimate Road project. So moving into the District 3 projects, one of the other things we see is that these large intersections really got a lot of votes. And so Tualatin Sherwood Road and Boone's Ferry Road received the largest number of votes in District 3. I think it's because that's where people have the most experience. People are traveling through these intersections of county arterials and they're experiencing delay and safety concerns and all of those things. So that was the highest vote getter in District 3. And then in District 4, again, our number one vote getter was the large intersection project. And I think this one actually received the most number of votes of any of the projects. And that was the intersection of Cornell Road and Brookwood Parkway. So a project we've been thinking about for a number of years there as well.
You almost get backed up on that project all day now.
Mhm.
I tried to go through there midday the other day and was backed up.
A lot of people are sharing that experience. And so that's why that project emerged there. So with all of that information in mind, the community input is only one of the many pieces of information that your board may choose to use when you go forward with prioritizing these projects for funding. And so this slide shows the other components that may be an element of that decision-making process for you. So you see the community input up here, along with the refined cost estimates, the risk assessment for each of the projects, whether or not they were previously funded, meaning are they already in the pipeline to receive construction dollars? What was their equity index score going back to the work that we did initially in screening these projects, and then any other other factors that may influence your decision in the end. So this is all a part of a big picture that we're putting together this year. So moving into our refined cost estimates and risk assessment for the projects. This is a new feature of our funding allocation for 23-28. We did not do this step in previous allocations. What we found is that it would have been valuable to do it in the past. It's really helpful to have the same lens applied to all the projects as we consider how much they're going to cost us and to consider the risk of each of the projects. So we hired Kittleson and Associates, which is an engineering firm that we use pretty frequently at all the jurisdictions in Washington County to do this type of work. And they evaluated our projects using the same metrics and cost assumptions. And some of the factors they considered were the cost of construction materials, stormwater management, right-of-way costs to build these projects, whether or not street lighting would be necessary, utilities, and then construction project management costs. And so this ran all those projects through the same screening. They also assessed the construction risk factor, which means what do we not know about this project and what will we likely not know until we get further into the design process. And so that flags for us basically how good our cost estimate is. If a project is really high risk, it might mean that our cost estimate could be underestimated as we go into it. So we're collecting all of this information for the projects, and this is what it looks like when we put it all together. So this table, again, is available in your packet since it's a little bit hard to read up here, but what you'll see is the project name, what the project is proposed for, meaning are we looking for design money, construction money, or match money? What was the score on our equity index, again, from the earlier work that we did? What was its ranking in the survey tool? Whether or not it was previously funded for design? What is the draft construction risk assessment? And then the proposed MSTIP allocation dollars. And the proposed allocation dollar is somewhat based on those refined cost estimates. But for some of these projects, if they were proposed, for example, for match, we didn't do a cost estimate of the project because we're looking at using match dollars rather than funding the entire cost of construction for the project.
Can I ask a clarifying question on that, though? If a project is for match, it's match. I'm wondering about match towards certain funding or match towards competitive grant. And so in that regard, it would, in the next phase, it would help me to understand the match risk, I guess.
Right, whether or not we know that it's certain or it's something we'll be competing for.
Yes.
Yep.
Yeah.
I think all of these that are listed as match are actually based on a competitive external source, or if it's not competitive, it could be like a direct earmark from the state or a legislative action, but something that we haven't yet identified. There are some projects on this list that we know have external funding already dedicated to them, and that would be like the Cornell Brookwood project, for example. It's a pretty high dollar project, but they've been putting together developer contributions and some money from the county's already in there.
Well, that's
So-
not a match, so.
Right, exactly. But its cost estimate number from
Yeah.
MSTIP proposed funding is lower than the total project cost we expect would be. So
I'm with you.
Yep.
Thank you.
I have a question on that as well. Those are in 2022 dollars, real dollars. Those are not projections. They're not price indexed at all, right?
the consultant did assume an escalation factor on these projects, assuming that we would not be delivering them all in 2022. And so there is some contingency and escalation assumed in each of
You
these
don't
cost
recall what that
estimates.
was?
I don't off the top of my head.
So if they're queued out,
Uh,
because it can't all be built in a year,
Mhm.
so if they're queued out, we don't know what those real costs are gonna be.
It would go up over
Well,
time. We know that.
I just wondered what we're guessing, yeah.
I thought in a prior presentation, it was like 30%. Least,
Yeah, I believe we applied a 30% contingency
yeah.
in there, and some of that is sort of getting at what Aaron was saying about the uncertainties in the project, kind of mitigating for that risk factor or the unknowns. And then I think Commissioner Rogers, to your question about cost escalation, over, the projects get delivered over a number of years. And so typically one of the things that we do is step back at the programmatic level and assume, projects might be delivered at, on average, say a midpoint of some point in time during that cycle, and assume some cost escalation at that point. So some projects may escalate less than that. Some projects will escalate more than that. So we have opportunities to try to ensure that we're providing a reasonable estimate of cost escalation in the individual projects, which over the course of the program, hopefully evens out.
Want to have 10, 11% inflation and everybody fights about who gets to be first in line. That's the issue.
Right. Yeah. And I would say obviously inflation is a barometer for projects like this, but there are a whole lot of individual factors of, supply chain, availability of steel,
All of that.
labor. Yeah. Lots and lots of different elements that go into that. So inflation can be kind of a helpful barometer, but there's a whole lot of specifics that go into those actual escalation numbers.
So we're still not going to get all of the numbers exactly right for the year that the projects are delivered, but we're trying to do more due diligence in advance than we did in previous cycles. Understanding that all these other things are going to happen on external forces. Commissioner Trees?
Could I ask you a question, please, about the funding for Beaverton Hillsdale, the project? It says that it was not previously funded for design. Is that correct?
It would say that probably in the materials.
I'm looking at the chart on the next district.
If we go to District 2.
Here it says.
Correct.
I thought that there was.
There's I think I would call that a concept plan.
Okay.
And then there was a
Versus the
50%,
design.
there was a 50% design that was prepared for portion of that work, which would be the realignment of Olson Road at Beaverton Hillsdale Highway.
And the reason I'm bringing this up is that I'm certain that there are people that are watching this closely. And there has been a lot of history there. And I just want to clarify that it's not that we're ignoring what history has been for that particular intersection. That's what I just want to bring that up here.
Yeah,
Right.
that's a
Because
very
I
good.
will probably get phone calls.
Yeah, that's a really good point.
That is a good
Commissioner.
point.
Yeah, and I think for purposes of our thinking about this project right now, we're sort of assuming that we would design the entire project with not just the element that was previously designed. We also think there may be opportunities to revisit some of the previous design assumptions in that project too. So we're sort of anticipating, not quite starting with a clean slate, but
We might want to put an asterisk or something on that one.
Well, I think for all of these that have possibilities, as part of the next phase, we're gonna have to be clear, what are we really aiming for? along the way.
That as well, yes.
Okay, so that we're clear on, well, I'll talk about the next thing.
And I'm just looking at this from the historical perspective so that it is recognized that the work has been done previously.
Yeah, thank you. I think that's a really good point. We were thinking about the projects that received funding in the last cycle. So projects that received 3E funds for design, and now we're looking at construction, but that project has so many years of
Yes.
history and so has had some previous work done.
Thank you.
And I couldn't, looking at these charts, I couldn't remember on Walker Road, is A to C going east to west or west to east? So in the next packet, I just need a tiny bit more info.
Yeah, so the A segment starts at Parkway and goes east to just before the Cedar Hills intersection. And then skips over the intersection, and C starts just east of the intersection and goes to 217. Any other questions on the district tables?
No one is appropriate, but I have a question back on the survey. And it was a question I asked you in a briefing. And I don't know whether you've had an opportunity to go back and look at it. I've always believed it's a system-wide, our system. And I know that when you took, and maybe I'm misunderstanding, so correct me. When you took these surveys by district, people say, well, here's what's important to me. Like District 3, here's what's important. If we'd ask the question, what, more importantly, what's important to you? If you had to pick 3 to 6 projects countywide, what would they be? Because frankly, the people in Tiger 12 and Sherwood don't stay there. Yeah, some do, but a lot of them are going elsewhere. And you said that'd been interesting. As I recall, you told me that'd been interesting to tease out. Do you have anything more on that, or do we not know? So the person in Hillsborough who comes to Tiger probably has a different idea on what's important to them versus if you only said what's in Hillsborough that you like. Does that make sense? Yeah.
It does. So in the survey instrument, when people took the online version, they were required to pick at least one project in each commissioner district and up to 3. And then they reported out to us their zip code. And so we can tease out a little bit of information about where people live and what they prioritized, but I don't think it's enough data points to really tell a super compelling story with that. When people took the paper survey, because we didn't have the same ability as we do an online survey to not allow them to complete until they pick something, they could just check some boxes and hand it back to us, and we didn't chase them down and make sure they checked more boxes. So we may have received some partially incomplete information, but we really did ask people countywide, and that survey tool was pushing people to try to answer countywide questions, not just in the district that they lived in.
So if I were to look at it, just don't want to be a dog on a bone with this one, but if I just look at the survey for District 4, where most of the folks, and I think this is true probably District 3 too, most of the folks are migrating in and migrating out. They're not necessarily just traveling. Do you feel that projects are reflective of what the desires are of that group who are coming in and out, not just the local residents who are area traveling?
I'm not sure. I'm not sure if people's experiences are different depending on if they're locals and staying local or if they're traveling through the county for the day. I think the fact that those large arterial intersections were our highest vote getters probably shows that that's where everybody goes, right? Whether they're taking local trips or county trips or regional trips, those are the places we're traveling.
An idea for the next time you do this.
Yeah, no, I think it's really interesting. And we would love to get 6,000 responses to all of our surveys so we could really tease out some of these effects.
Thanks.
And I think Commissioner, we did get some zip code information or asked people for zip code information. So that tells us a little bit of something, either where they live or where they work, but it really doesn't help us to understand their travel patterns.
Yeah.
And that kind of data at that granular level is very difficult to get. So I think, like Aaron said, the structure of the survey really was designed to ask people to think about needs in all the different parts of the county. And so we're hopeful that people took that to heart. But as Aaron said, we weren't chasing people down and making them answer every, their top priorities in every district.
Okay, thank you.
Yeah.
So we'll move on then from these tables and talk a little bit about our next steps. So we are planning to come back to you, I believe next month, and have a bit of a more comprehensive conversation about transportation funding in general, not just MSTIP. How do we fund our transportation system from a variety of different sources? And so we'll be having that conversation with you, and then that will kick off our discussion about how to prioritize these projects based on the information that we have and what we think we'll have available for funding at that time. Because of having that more comprehensive conversation, it pushed out our timeline a little bit from when we think we'll be bringing you a recommended project package and having that conversation with the WCCC in advance of that. So we think we'll be back in early 2023 to have you actually take formal action on the prioritized package. Ongoing, we'll be seeking strategic opportunities to think about phasing project construction and also looking for funding for all of these projects from other funding sources. I think our lesson learned is that all of these projects are really popular, and so we will be continuing to seek funding for them. The MSTIP program may not be the most appropriate for all of the projects, and of course, we know we can't fund them all. So we'll be thinking strategically about where we can bring in other funds. And then I think we have our timeline graphic. I just realized right before this presentation that we haven't been putting the completed box under all the things we've completed, and we've actually completed through milestone 3 at this point. So you can see that we are here in about September of 22. And so we're moving towards that Q1 of 2023. And I think it's just back to the policy questions. So any questions?
Commissioners, any questions or direction on these various policy issues?
I've asked my questions. Thank you.
Yeah, no, I'm good. I think it's good information.
And I'm in support.
Commissioner Fye?
Yeah,
The only one
I'm
heard from.
yeah, I'm good. And Chris, welcome back. You missed a hell of a week last week.
I'm never letting her take off another.
Yes, you are.
impact week.
Great place to work.
Quite the timing you did. but-
And they survived. Hopefully didn't call you on your vacation. Did they call you on your vacation?
I was in touch
Dang.
She missed us.
We missed each other.
So all 4 of my colleagues are all set, so I'll do my part to answer the questions. I don't have any questions about the community engagement efforts specifically. Rather, before the project ends, you've done a really good job, and I really appreciate how engaged you were, how you got the word out to the community about the online survey, and you were really present where the community was at. Just job well done. But I know you've done things differently than in the past. So before the project ends, I'd like to hear the staff's thoughts on what worked and what might you like to carry forward the next time around. Maybe do it the same way, or do this differently, or include this, perhaps reflective of the conversation you had with Commissioner Rogers earlier. Do I have any questions about the refined project list and estimates? Nothing more than I've already asked about. So what additional information would be valuable to your support of upcoming transportation needs and project prioritization? Here's where I have 2 schools of thought. I'd really like to hear what full city councils think, as well as what WCCC as a collective thinks. And for each of them, include why, later on in the process, why their ranking differs from the public engagement thinking, or ranking rather. On that same question, but different aspect, later on, I'm gonna need the reminder of the total pot of money that we'll be working to allocate for this 5-year investment window. And that includes things, things that I'm thinking about is, okay, by virtue of funding, some projects will have actual construction results on the ground, right? Other projects may only have what I call paper results, design, preliminary design, which has a different feel or outcome nature for the community. And other ones may just advance, you know, and specifically what I'm thinking about here is there may be some that are a match for construction dollars that are certain or not, or match for the possibility of some future funding closure. And so I think about what kind of messages, outcome messages we want to be able to deliver for our community at the total end of the process, the end of this investment planning process. And so in order to reach that clarity, I'm going to need some additional information to help me narrow down. You've provided us with a great range of possibilities, and I really appreciate that. But at some point, we're going to have to make some uncomfortable decisions. Because like the community says, all these projects are important, but we're going to have to choose which ones have the benefit of 5-year investment now. Does that help?
It does.
Cool.
You know, we began the process by going to each of the city councils. And we learned so much from hearing the different voices, and especially elected officials who hadn't been around the process before. So it is, I think it's an interesting idea, good idea to sort of circle back.
And you know, I realize now that when we get to that early 2023 and board approval, then we'll take an action and there will be a report back to city councils. There will be some different butts in those seats.
Oh, good point.
Oh, boy.
Interesting choice of language. I do.
Are you referring to the, yeah?
Yeah. Chris, to what you said about going to city councils, obviously, large portions of my district is unincorporated for Washington County, so just like providing voice for the unincorporated as well.
So we're doing another round of comments. Other commissioners, do you have anything more?
Nope.
Okay, I don't have anything more to add to my final closure than I already did. Thank you.
Thank you.
Thank you.
Okay, it's 26 minutes to the hour. We get a break before we go into executive session. So why don't we take a break and then we'll come back and do the adjournment to executive session. So see you back here at 8 minutes before the hour of 3. Thank you.
Jerry just pointed out that I have this hanging on my sweater.